Good morning. Is coming to the tattooing. This is a old technique, good old technique, and there are two different types. And one is the dyeing with gold and platinum chloride, or with any pigments, carbon pigments. Commonest one is the Indian ink. The gold and platinum chloride is applied to the cornea, denuded after removing the epithelium. Then hydrazine solution, if you add that, that's basically a tissue staining technique used in pathology that is routinely practiced in corneal tattooing. The other thing is the pigments. Commonest one is the candle soot or lamp soot or Indian ink on any tattoo dyes which you use for the skin. The tattoo dyes you can buy from the market. They are quite cheap and quite easily available now in India, and you can use it. And the lamp soot, you can make it in your own before the surgery. Just take a candle and take it, and this is a lamp soot. You collect it how much you want, sterile one. And the best thing is to put it in a pocket. If you put the dye in a pocket, it lasts for a long time than on the surface. On the surface, it looks more bright and more black. And take the lamp soot and take a spatula and insert into that. And the same soot, you can use it on the top of the cornea also, and you can do multiple pricks so that it will go subepithelially into the stroma and stays superficial portion also will be. Only thing is, in adherent leukomas, you should be a little careful not to perforate and not to enter into that. Maybe anti-segment OCT will help us how much stroma is there in these cases. And superficially also you can attach that. It works quite good. And if you have very bad cornea like this, you have to do both superficial and deep, and you have to take a lamellar pocket. And here is bit difficult. Making a 10 mm pocket is a bit tricky, but it's doable. Here you need to use a blunt instruments and do that, and make a pocket and inject the. This is a tattoo skin dye, which is already available as a solution, whereas the lamp soot is not dissolvable in water, and the skin tattoo dyes are already available as a solution. That is the advantage of this dye. And over the surface is quite a simple technique. You debride the epithelium, but with tattoo machine you don't need to debride the epithelium, and the machine is nothing but ultrasound needle attached to ultrasound piezoelectric, like our phaco machine. It will keep on oscillating. So you use the depth and you use the frequency, and you can put the dye, and the dye goes subepithelial. You don't need to scrape the epithelium. And if it's really bad cornea is there, and which you think is not good for tattooing, you can remove that and do a lamellar grafting, and after enough depth of lamellar graft, and between the graft and do this, I found is a very nice technique, and it gives very good results in bad corneas, and the results are quite good. Thank you.